Hi, my name is Nurse Richard, otherwise known as the Wax Wizard, and I'm here to debunk a few myths for you. Now, one of the questions I get asked mostly in my clinic is, do these things work? Now, what are these? These are hoppy ear candles, or sometimes people call it ear coning. So I thought we'd just do a quick, completely non-scientific experiment to see if these things actually work, and I can explain to you why they don't. If you've not got the patience or time to look to the end of the video and see if they work, I'll tell you no, they don't. But let's find out why, and I will explain a bit of the science behind it. So how do you use them? So what they do is they put these little foil, like a drip tray they call it, on the end of it, and that's to prevent any hot wax or ash dripping onto the ear canal, which we have seen a lot of injuries for. You actually do get a little tip on the end of this. And this one, it was that loose when I got it out of the packet. So you put that in your ear, that beast is going to fall out and fall inside your ear, which is not good, obviously. So what I'm going to do, I'm going to conduct a highly scientific experiment here. I've got one of these candles, I've got a mug, so I'm going to put this in the mug. So it's going to be essentially like a fake ear canal. And then I'm going to light it. And then we're going to have a look just to see if there's anything collected at the bottom of this mug. And at the end of it, I'll get this out, we'll cut it open, and we'll see what's actually inside this candle to see what it claims to have drawn out. There's nothing in this cup, it is empty. Now I'll leave that running along the side of the video, so you'll see it slowly burning down, and then we'll have a look at it at the end of the video. So where do they come from? And how do they get the name hoppy ear candles? Now, the name hoppy comes from a North American native tribe, and the tribal council repeatedly deny that these have anything to do with them, that they've ever used them. They don't recommend them. They say it's not a part of the therapy that they've ever used. So who performs it? Now, mostly it's done by some complementary therapists, beauticians. You can even buy these online. I got these from Amazon, widely available. I think these cost about £5. You got 10 candles in that. So how do they claim it works? Now, the theory is they say that they light the end of this, you put that in your ear, and it creates what they call the chimney effects. It creates negative pressure, creates a vacuum that draws out debris and wax and moisture, they say, out of the ear canal. We'll get onto that later. They also claim that it heats up the ear canal, it heats up the wax, makes it softer, so it melts it, and then it comes out a few days later. Again, we will get onto that later. So what are the benefits that these practitioners say that these things have? Now, a lot of them do claim that it removes earwax. They also say it helps the nasal passages, it helps sore throats. They also say that it can help with sinus trouble, relieve stress, relieve headaches, and believe it or not, they say it can get rid of ear infections. Again, let's look at the science behind that in a bit. So what do the experts say? Well, here in the UK, we have NICE guidelines. Now, these are conducted by searching all the evidence, clinical trials, and seeing if there's any actual scientific data into this. And so far, the NICE guideline states that there is no evidence that ear candling removes any kind of earwax. In fact, they go on to say that it's likely or very possible that it can cause serious injury. Here in the UK, there's currently no restrictions on them. Anybody's allowed to purchase them and manufacture them. I believe in the US, the FDA are trying to get them stopped from being made. They're strongly advising people do not use them because they say they're extremely dangerous. There was also a survey of specialists, and I think they had 122 specialists responded to this, asking them if they'd ever treated anybody with any complications of ear candling. 22 of them responded. 22 had treated some problems, which included ear infections, temporary hearing loss, perforated eardrum, burns in the ear canal, and actually causing a wax impaction or making a wax impaction even worse than it was before the treatment. So one experiment tested the temperature below these ear candles when they were lit. So they lit the candle at the top there, because the theory is that it creates warm air and helps to relax and melt this wax anyway. They had a model ear, they lit this candle, and they put a thermometer about a centimetre, which is about that far away from the bottom of the base of the candle, and the highest temperature we recorded was 22 degrees Celsius. Now, core body temperature is about 36, 37 degrees Celsius. So there's absolutely zero evidence that this actually puts any warmth into the air at all. So this chimney effect, so they call, does it create a vacuum? Now, a study was conducted again with a model here, where they put this in, and then they had a machine that measured the air pressure to see if there was any change in it. And surprise, surprise, there was no change, no negative pressure created. That means there was no suction coming from the base of these candles. Right, so our candle has finished burning now, as you can see there. Just dabbed it out with a damp tissue. Let's see what's happened. Right, so good to see that the little bung is still on there. It's not fallen out into your ear. Let's have a look inside that cup. Now, don't know about you, but I can see that was clean as a whistle before. That was white, and now you can see all the rings all around that. Now, that's not tea stains. I don't know what that is, but I guarantee it wasn't there before. And let's have a look inside this candle to see all the wax that's been pulled out magically. I'll take the cap off there. Let's take that off there. And let's try and cut it open. Actually, you might be able to peel this. Peel that open. Ooh, some kind of strange sponge bit on there. But look at that there. Oh, I dropped it on the floor. No, it's not, it's here. There we go. Can you see that? No, yeah. It may look a bit waxy. It's actually purple. So we've managed to remove some purple earwax for somebody, but to the untrained eye, you could quite happily convince somebody who didn't know that that has just come out of their ear. But it hasn't. And in the interest of fairness, I did this another 2 times, and here's the residue that what came out of these further 2 candles. Now, it could be mistaken for earwax to the untrained eye, you know. It's got a bit of a purpley tinge to it now. That's because it's a purple candle. I imagine different coloured candles might well make different coloured wax blobs. Who knows? But to the untrained eye, you could easily fool somebody into thinking that that's just come out your ear. It hasn't. It was in the candle itself. So this so-called chimney effect creating this vacuum that sucks it out. Now, what do I actually need to suck earwax out? Now, this here you can see, this is my machine. This is a medical device. I believe it or not, some of those candles they have on the labels that it's a medical grade device. What that even means, I don't know. They've just self-certified that. You'll see some of them say CE mark as well. It's basically self-certifying that you say, yes, it meets these certain standards. What the checks are, I don't think they're very thorough at all. You can just fill in a form, I think, and send off for it. But anyway, what do you actually need to suction earwax out of somebody's ear? Now, you need a machine like this, and as you can see there, I've just put my thumb above the suction tube, and you can see it just gently pinching and putting a little bit of pressure as it pulls the skin away there. Now, that's the small amount of pressure that you actually need to suction earwax out of somebody's ear. Because by the time it goes from that machine, goes through the small tubes, it's reduced. Then it creates just the right amount. So have a think about it. A big machine like that to create a small amount of vacuum like that, do you think a little candle like this is going to create any type of suction to suck something out of your ear? Absolutely not. So what we're saying in conclusion, do they work? No. Are they a scam? In my opinion, yes, 100%. Please do not buy them. They don't work. Chances are you're just going to end up doing yourself some serious damage. So please stay away from them. If you hear anybody else using them, then please show them this video, explain to them that there's absolutely zero evidence, and chances are you're going to come to you're going to put yourself to some mischief, so to speak. So feel free to share this video if you think it might help somebody else. But for now, take care of yourselves, and I'll see you later. Bye-bye.